I was seeing patients and sort of discovered public health. And when I got there, and I was in Boston for a year, and I remember sitting in one of the classrooms and going, this is it. This is what I want to do. And the reason was I discovered that there was this whole science around preventing disease and illness for entire populations. I never knew that before. And I just marveled at that. So I learned all about the epidemiology and the statistics and about the healthcare systems from a system perspective. We learned about the social and behavioral factors in public health and a lot about environmental public health and sort of collectively. But it was really about what's the evidence that if you make a change, it could be a policy change, it could be a program, it could be an education, but if something that you change, you can improve the health of an entire population. That was the aha.
Welcome to Public Health Careers. I'm your host, Omari Richards, founder of the Public Health Millennial. We're going to dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies, get tips, while also learning from others to help you in your own journey and learning of public health. Learn about the vast world of public health careers, or just hear public health stories. Stay tuned so we can do our part towards a culture of health, well-being, and equity for all. Hey friends, welcome to Public Health Careers. Today I interview the very accomplished Dr. Jan K. Carney, MD, MPH, MACP. She is the Master of Public Health Program Director and Associate Dean for Public Health and Health Policy, as well as Professor of Medicine at the Larner College of Medicine at the University of Vermont. Dr. Carney is active in public health practice, research, education, and service. She served as Vermont Commissioner of Health under 3 gubernatorial administrations, championing improvements in children's health insurance, preventing teen smoking, and improving cancer screening. She received the Vermont Public Health Association's Public Health Champion Award in 2018 and was recently awarded the UVM President's Distinguished University Citizenship and Service Award for innovative teaching, creative leadership, and service to the UVM community. She earned a BA from Middlebury College, an MD from the University of Cincinnati College of Medicine, and a Master of Public Health from the Harvard School of Public Health. In today's episode, you'll hear and learn more about her learnings from being the author of A History of Public Health from Past to Present. She shares her perspectives on what should research goals look like for public health programs and how to increase access to public health education through online learning. She also talks about her extensive experience in being the State of Vermont Commissioner of Health for 14 years. Please subscribe if you have not as yet and share this episode with a friend. There's a lot of value here. I hope you all enjoy.
This is Jan Carney. I go with she and her pronouns. I'm a professor of medicine, associate dean for public health at the Larner College of Medicine at the University of Vermont, and you are listening to Public Health Careers.
Welcome to the show, Dr. Jan Carney. I'm so excited to have you on and all your expertise.
Thank you. I'm delighted to be here.
It is our pleasure. It is our pleasure. And you did identify part of yourself earlier by saying that your pronouns are she, her. Can you tell us a little bit about your personal background?
Let's see. I grew up in New Jersey and ended up in Vermont for college, and loved the northern New England area. Liked the colder weather, and then did my medical education in the Midwest at the University of Cincinnati, and then came back here for my medical residency, and pretty much stayed. I got my Master of Public Health degree at the Harvard School of Public Health, and then have been here for the most of my career, and it's been great.
It sounds like it's been great, and I'm very excited and interested to hear about your perspective change going from being a physician to then going more into public health and now leading a school of public health, which I think is really, or a college of medicine that does public health work, which is really, really admirable. And I can imagine it's going to be quite the story. So before we get more into your collegiate journey and your start into your medical/public health journey, you are the author of A History of Public Health from Past to Present. what are the themes of this book that are most relevant for us to understand as people that are listening to this podcast navigate their careers?
I learned so much. When you undertake the research for a book, and I really thought about that is how I'll teach my students with this, and what can we learn with it from this, and how can it help us in today's public health practice? And I have to tell you that I just learned a ton. And some of the things were that, that how relevant history and past experiences are for some of the issues. And I can give you a couple examples and some themes. Some of the themes were that people believed certain things were that now we know are related to science and medicine, as an example. But those beliefs, or even when we had evidence for something, changing our mind to as the evidence changes for new science, and people, it's human nature to just hold on to those beliefs, even in the face of all this evidence. That to me is a theme that's highly relevant. We just coming out of the pandemic, we learned so much new. We learned about vaccines. We learned about how this particular virus was spread, but still those beliefs weren't necessarily in alignment with what the science told us. So that was a theme throughout. Some specific areas that I think are really relevant were starting in maybe the late 50s and 60s, there were a series of events that collectively resulted in our environmental awakening. Everything from air pollution and smog and weather inversions in London and Denora, Pennsylvania, where people got all kinds of respiratory illness and there were deaths. Water quality. It was DDT and Silent Spring, Rachel Carson's Silent Spring publication, and the beginning of this collective environmental advocacy. That took time. It probably happened over 10, 20, 30 years. But as I look at that, and it's sort of some of the things that culminated, there was such pollution in rivers that rivers burned. And if you can imagine such a thing, but it all ultimately came together and resulted in new federal policy and laws, and some of the food safety laws passed around that time, and FDA, and improvements in air quality, water quality in our environment. So fast forward, look at where we are now. We're struggling with the human health effects of climate change. And so as I think about this, some of my messages have been to students and people I work with, that we just can't lose heart. We have to remember that we can make progress in public health, but sometimes it takes not just months, but years and even decades of persistent research and scientific and practice advocacy from all kinds of health professionals, and that is the role of public health.
That definitely resonates with me, and I can imagine it resonates with the audience as well. Just the first thing around the gap or the space for like misinformation, and the information that the public has not caught up, or the science that is out there has not caught up with the public's perception of things, and that creates opportunities for misinformation, which we have seen and we continue to see in the field, as well as I think the important point of the collective advocacy is like we need to see that there are issues and then come together and bring the stakeholders together to say like, this is not right. How do we come together and raise our voices? And as you stated, it takes a long time. Sometimes it takes 10 years, sometimes it takes 20 years. But at the end of the day, it was able to leverage those voices from the people that were being affected by the issues to have federal policy change, to have laws change, so that we know better, and now we can do better to prevent and keep communities healthy.
Yeah, and I mean, there were lots of examples, but at one point, maybe in the 60s, 60s and beginning of 70s when we started to have a lot of antibiotics and vaccines for disease. And there was this misperception that we really, we'd figured out how to prevent or fight infectious diseases. And nothing could have been farther from the truth. We had Legionnaire's disease, and we had AIDS and HIV. And fast forward, all kinds of new and emerging infections. There was a book written called The Coming Plague. And then come all the way up to the recent pandemic and think about in public health, and it's human nature in part, but these cycles of what some people call panic and neglect, so that you respond to a crisis and it's all hands on deck and everyone does everything they possibly can. And then as soon as that crisis has passed, everyone relaxes, and that preparedness, sometimes the attention to preparedness isn't there. And in part that's human nature, but we really need to be prepared, because our cycle of infections and new infections that we've never seen before, they may be related to zoonotic diseases. It's way better, as we know in public health, to prevent disease and illness than to respond to it after the fact all the time, and when the consequences can be way more severe. So I would say that was another really important theme throughout. And then maybe a last one I would mention is the importance of advocacy again. And there were so many issues that, yes, the science and the healthcare was really important, but the grassroots advocacy to shine the light on something that needed to change to make people's health and lives better, that was really important. We saw that in HIV/AIDS and ACT UP and People with AIDS Coalition, and that was so important in really moving government and policy forward in terms of treatments, prevention, the science. It was critically important. And you think about another example was around Mothers Against Drunk Driving. And that started when a mother lost her daughter from a drunk driver, and she just never gave up until nationwide we had this patchwork of laws and policies, and that started to change. And some of those laws and policies to prevent people who had too much to drink from driving, or there were consequences of that. There were better laws, there was much more education and that advocacy. And that was one person starting all this. So to me, that's another really important theme of even when things are very bleak, when health consequences are severe or conditions are just terrible, that you can still make a difference. And advocacy for public health is alive and well.
And that just shows the power of what having your voice and sharing your voice and continuing to be persistent in sharing that, like, this is not okay, what that can come with, like getting the Mothers Against Drunk Driving. I think that's a great example. And just highlighting earlier the point of like not getting complacent in public health, because when things are going well in public health, that's when everyone doesn't see anything, and many times funding is cut. And then when things get bad, that's when you hear about all of this panic and all of the different things. So it's really thinking about how do we create a system that isn't complacent at any point in time, especially as we see more and new diseases that are coming out because of climate change and other reasons, just being prepared for whatever is over the horizon.
Right. Yeah, exactly.
So you currently serve on the Board of Regents for the American College of Physicians, and you recently served as a vice chair of the American College of Physicians Health and Public Policy Committee. Having experience being both a physician as well as a public health professional, can you talk more about some of those intersections that you've seen in this work around medicine and public health?
Yeah, yes. It feels like, from my vantage point, that the worlds of healthcare, medicine, nursing, all the other health professionals, and public health are in much closer alignment. So, because many of the issues that people who are delivering healthcare, whether it's in an office or hospital setting, to patients, also some of these policies and certainly the public health issues impact them as well. Let me give me a couple examples of things that are real, in my opinion, really critical health and public policy issues. Healthcare, access to healthcare, and specifically health insurance. And if we look at the United States compared to other high-income peer countries, we're the only one that hasn't yet figured out how to give everyone basic health insurance. That doesn't necessarily mean people will have guarantee that people have access to healthcare, but it's one of the most foundational impediments to that, right? Having that health insurance. And so that's something that, as a physician, as a public health professional, as someone who is part of a large medical professional association, we advocate for. Because over time, the history of that in our country it's taken a long time. It took a long time to get Medicare in the 60s, and then much later to get Obamacare or the Affordable Care Act in 2010. And both of those added tremendous benefit. But we still have so many people in our country who don't have regular access to health insurance, and it varies state by state. And it's not only expensive, it's very complicated for people to understand. So that's a huge issue that intersects healthcare and public health worlds. And many of these, we mentioned, we talked a little bit about climate change, but that's clearly something on the minds of both physicians and public health professionals and many others in terms of our policies going forward. The human health impacts everything from extreme weather to the heat waves that have been causing tremendous harm in different parts of the country, and wildfires. All of these things have become worse over time. And so collectively, looking at the science, what are the things that we can all do in our respective roles to advocate for solutions for that? That's another one. Another broad area I might mention would be around social determinants of health. And I sometimes call that social and structural determinants of health to include our history of systemic racism in our country as part of that. And if we look at what determines people's overall health, healthcare is a piece of that, but it's much broader than that. It's our habits and behaviors. If we have access to enough food and high quality food, if we're able to be physically active, whether or not we use tobacco products or too much alcohol or drug use, those kinds of things. Also our environment, we mentioned that. And then the social determinants of health, things like whether you have enough food, whether you have a job that pays a livable wage, whether you have a house, a place to even live on a temporary basis. What are your social connections like? And previously we thought, and a lot of the literature was around social connections and people as they get older, but I think that the pandemic showed us very clearly how important we're all human. Our social connections at every age, and the kids and young adults in school settings, high school, college, there was no one who wasn't impacted by being isolated for a period of time. So all these factors work together in those social determinants of health, and those are we need to advocate for improvements in people's health and the quality of their lives.
Yeah, just really understanding that there are so many factors that go into health, and we really have to think about it holistically and create systems and structures that are able to support communities, especially the communities that have been most disinvested, most marginalized, because it's important that they are also able to self-realize and have their best health. So before we get more into your collegiate journey and your journey to becoming a physician and then transitioning into more public health work, what does public health mean to you?
Public health means to me assuring the conditions in which people can be healthy. And that's really broad, and that encompasses a lot. I also think about all the time sort of what we mean by health equity is that every single person has the opportunity for good health. And that includes all those different factors we've been talking about.
You got your Bachelors of Biology, French, and Premedical Studies at Middlebury College. Tell us about the thought process of going into undergraduate.
Well, I knew I wanted to be a physician when I was really young. And that was, you don't understand at the time what really that's all about. But I became, when I was in elementary school, I became very interested in science and wanted to help people. And it was that simple. So I went to college with that in mind. And I took the courses that you do to prepare you for going to medical school. But along the way, it was really important to have a broad education and things like writing, foreign language, and did my best to have as broad an education as I could. I still think that I'm so glad I did. And I really think that's important because people are from all over and all walks of life. And the broader your background and education, the easier it is to talk to people and help them.
Yeah, absolutely. I definitely resonate with that. And I think too many times we try to box ourselves in, but understanding that education happens in many different aspects. And even though that you're thinking about whether that's public health or going to medical school, understanding that while you are getting those fundamental courses that you need to get to that next level, there are other ways to incorporate like more cultural understanding or just appreciation for all the different types of people and cultures that are out there. So that makes a lot of sense. And then before you moved on to your Doctor of Medicine at the University of Cincinnati College of Medicine, did you have any like key takeaways that you had from undergrad that you think would be helpful to share with us?
Well, I spent time either volunteering and working in a hospital, or I actually worked as a nurse's aide in the summer. And I also worked for my father, who was a dentist. So I got to see help with his practice. And when we think about, we tend to segment healthcare, but one of the experience I had when I was in college, I worked on the psychiatric unit in the hospital. And so you see how important mental health is to overall health. And likewise, oral health and dental care is, again, something that's really, really important. So I think more of a holistic perspective of that from some of both the summer jobs I did and some of the volunteer work I did along the way. And all those, I think they sort of, you have these experiences and you do what you can to educate yourself. And then hopefully over time, they together kind of sink in and help frame your views about what you think is important in your goal to help people.
Yeah, and as you mentioned, like mental health and realizing that that was important throughout your experiences that you had throughout undergrad. What has that frame around mental health, like how has that changed as you've grown in your career?
I think that as I've gotten farther along in public health, how I still think things are a little bit too segmented, that we don't necessarily consider all of physical and mental health together. I still think there's stigma in parts of that. I think our access is far worse for some aspects of mental health, and we saw that after the pandemic and the tremendous needs for that. And there is a role both for government agencies, but it might be different government agencies. And in our state, we where I am now in Vermont, the rural parts of the state and in rural parts of our country, the access is even more challenging. So I think that it's been, I would say that some of our challenges with ensuring enough access to mental health services for people, I would call that more of an enduring or long-term problem because it's really complicated. I don't think we've totally figured it out. And it's something that when I think about healthcare, I think about that together, mental health as a piece of that. In the same way I think about people need dental care. They need primary care, they need dental care, they need to have access to a range of things, perhaps at different parts of their lives, in order to maintain their own health.
Yeah, absolutely. As you said, it's multifaceted, and you really have to think about all the different ways that you can get tuned into supporting people and communities' health. So you graduated from your bachelor's degree, and then you pursued a Doctor of Medicine at the University of Cincinnati College of Medicine. Tell us about the thought process while you were going in here.
When you study medicine, it's like they call it like a fire hose, and there's so much information, and it's by the time you graduate, a lot of that is already obsolete. So part of what you have to figure out is what's important, what do I have to memorize and learn now, and then you start to develop these habits of teaching yourself for lifelong learning, because in order to keep up as things change, and so that you're always on top of the science and the knowledge that you need to help your patients or help the public in the case of public health. So that was really quite the learning experience. I also think that, we talked earlier a little bit about social determinants of health, but the medical school that I attended was right in the middle of the city, and it was a large urban area, and there was a lot of poverty. And so that, I think that's something that really stayed with me in terms of part of people's health. It's integrated into social determinants of health. And that was really, I think, sort of in the background as I was moving into public health as for the large part of my career, because you really can't separate that. So improving the conditions where people can be healthy. So part of that is having access to healthcare. Another part of it is having enough food and having a place to live, and having access to education and employment, and all of those things, and transportation sometimes. All of those are critically important. And I saw that pretty much when I was in the parts of my training where we worked actually in different parts of the hospital. I saw that on a daily basis.
Yeah, so really just making you aware that though healthcare is something that's very important and fundamental to someone's health, there are all these other needs that have to be met to ensure that these people are healthy. Like you named quite a few of the social determinants of health: healthcare, food, housing, education, employment, transportation, which are all things that we have to think about when we are approaching populations to see how we can best address their needs. And then in this same vein of light, I'd imagine that you probably have also many or some experiences where you can remember being in a healthcare setting and and you can realize like health inequities taking place or health disparities taking place. Do you have any stories or memories around that you wanted to share with us?
I think the health inequities I saw around poverty, and when I would see people when I was in medical school, in the emergency room or in the hospital, and they were really ill. And part of the reason they were really ill is they hadn't had the opportunity to have health care along the way to prevent themselves from getting either taken care of or seen, or the knowledge to know how sick they were getting and be able to get any care sooner. There was not that opportunity. So I would say that I saw really the impacts of poverty on a day-to-day basis and neighborhoods. And now when I talk about some of this, people talk about your zip code is a bigger predictor of your health than your genetic code. I saw that in the neighborhoods that surrounded that hospital. And depending on where someone lived, that was a predictor of poor health, bad neighborhood, meaning poor neighborhood or dangerous neighborhood, violence at certain points of time, and the inequities related to poverty. And unfortunately, I saw that over and over again.
Yeah, yeah, that's like the broad intersection that most of those things or people lack of having many of those social determinants fall up to. If you're in poverty, you're probably dealing with a whole host of these other social determinants of health needs that you just aren't getting met, and then it's a vicious cycle going downwards. And I could imagine how that could like just widen your perspective to understand, wow, this is really happening, and understanding that like these systems aren't set up in a certain way to support these people in the best way possible. Case in point, many people without health insurance who are living in poverty are coming to the emergency room to seek health care outside of having a provider a primary care provider that's able to support them. And to that point of like lack of health literacy and knowledge about what to do. These are all things that are going on in the background. When during your journey did you learn about the term or the field of public health? Because after your degree as a physician, you decided to pursue a master's of public health. But when did that term come up for you? Was it as you were realizing about the poverty and all the other social determinants of health?
Well, I finished my residency, so I'm an internal medicine specialist, and that's a physician for adults. And so I did my residency here in Vermont, and you take care, and mostly what you did was take care of patients in the hospital. And sort of I realized later, a little bit later after I was done, that many of the patients that I took care of who were hospitalized may have been the consequence of a habit and behavior in public health later, that we try to prevent. For example, people who had lung cancer from decades of tobacco use, or cardiovascular disease that was related to long-term tobacco. Tobacco was a huge factor in some of that. But I was out. I was seeing patients, and I actually went to a medical conference, and it was all about public health. And I really didn't have that much of that in medical school. We didn't back then, and so I became curious, and one thing led to another, and I decided to apply to public health programs, and ended up going and getting my master's in public health. So I was already a physician. I was already a specialist in internal medicine. I was seeing patients and sort of discovered public health. And when I got there, and I was in Boston for a year, and I remember sitting in one of the classrooms and going, this is it. This is what I want to do. And the reason was I discovered that there was this whole science around preventing disease and illness for entire populations. I never knew that before. And I just marveled at that. So I learned all about the epidemiology and the statistics, and about the healthcare systems from a system perspective. We learned about the social and behavioral factors in public health, and a lot about environmental public health, and sort of collectively. But it was really about what's the evidence that if you make a change, it could be a policy change, it could be a program, it could be an education, but if something that you change, you can improve the health of an entire population. That was the aha. Oh my goodness. You could prevent some of this awful stuff and the suffering and the illness and diseases that people had. Those were missed opportunities for prevention. So when I came back from that year and came back to Vermont, and I was seeing patients, and I decided that I needed to do what I could to find a place where I could actually use this education that I have together with my medical knowledge and experience, and see if there was something that I could do to help entire populations improve their health. And so within a couple of years, I became the state health commissioner for Vermont, Commissioner of Health. You're in charge of, in Vermont, we have one state health department with 12 district offices around the state. There's no separate county or local health departments. It's different everywhere, and many states have autonomous county and local health departments. We had one state health department with offices all over the state. Public health nurses were in those offices. We had all kinds of people working in the health department. That was probably the most incredible opportunity and responsibility all at the same time. So I was there for almost 14 years, and I worked for 3 different governors, both Democrat and Republican, which was pretty amazing. And the opportunity was to, at that time, women weren't getting enough women weren't getting prenatal care, and our infant mortality rates were too high. So there was a changed Medicaid system here in Vermont to expand access to pregnant women and children to the age of 6. Our public health nurses educated women and helped them find a physician if they needed one, or a midwife. And that we saw dramatic improvements. The next governor I worked for expanded health insurance such that every child up to age 18 was eligible for health insurance. That was huge. And different governors made improvements to the health system here. We made cancer screening for women free from programs, created new data systems, a cancer registry. And one of the big things was a huge coalition of public health professionals, school nurses, legislators. And our legislature got together because teen smoking rates were way too high, and looked at the science put out by CDC and tried to put that into practice. So they did all kinds of wonderful things. They raised the price of tobacco products, which for a young person just starting to experiment with tobacco and that nicotine addiction, it was like a brick wall. And so that was one thing that helped. Lots of educational programs in the school, and collectively, some of those policies and programs cut tobacco use rates in half among those teenagers. And if you kind of fast forward into a really good investment in preventive medicine and public health, that was a great example. So I just had every day was an adventure, and was very fortunate to be in a state that is very health conscious and work together. And those partnerships, it doesn't happen if you don't have partnerships among not the people you always work with who already know, yes, we should do this, but you figure out new partners, and that could be your schools, it could be businesses that you work with, your legislators who need to pass the budgets to support some of these things or some of the policies, and we know some of them are hotly debated, but all those things, if people are able to work together, you can make tremendous strides in improving people's health and lives.
Going from internal medicine and realizing that there were these issues out there that were systemic and population based and could be prevented, to going into your master's of public health at Harvard School of Public Health and being able to actually tangibly get the skill sets to do the work, and then from there becoming the state of Vermont Commissioner of Health, which you held for 14 years. That is phenomenal, first of all. So kudos to you for being able to leverage the work and the experience that you have done to be able to do that work. And I guess the first question that I have, because many times I do hear that people shift out of their positions when a new governor comes in because the priorities might have shifted. How were you able to navigate that?
I'd never taken a political science course, so it wasn't skill. I think that, and all the people I worked with, it's not, you don't do it by yourself. It's always about the team that you're working with. And I think that the only thing I can say is that we always tried to do everything we could to help people where we lived. And I think people notice that, and that's a good thing, right? Because the fact that yes, people do change when the parties change, political parties, and that's very common. The public benefits when all those people don't change, because you have some of the continuity to keep working on things and because they don't change overnight.
Right. That makes sense. And then being the Commissioner of Health for 14 years and the work that you spoke of being able to build partnerships and work collaboratively with people across the aisle and people that are working in different domains of work. What types of advice do you have for people that are trying to get that kind of stakeholder buy-in and those deeper partnerships?
I think that those partnerships, you accomplish the size and the complexity and sometimes the enduring nature of some of these public health issues. These are hard problems, right? And so you can't do it by yourself. So you really have to reach out, and depends what the issue is. But if you have a group of people who are all trying to accomplish the same thing, your likelihood of doing that, and everybody brings, even without more funding, you bring more resources to bear on an issue because everyone makes it their priority. And that, in terms of if I would say one strategy that really has served us well over many different issues, it was that, being able to do that. I think something that, we talk about, people talk about partisan politics, but I would make a distinction between politics and public health, or the environment in which our government is. If you work in a health department at all, or you work for the government agency in public health, you're part of that whole system. So you have to think about not one party or the other. You have to think about how over time public health is for everyone, is everyone's health. So how can you be not understand the politics, but not be partisan? And some of the things I learned, that just, a lot of these issues are quite controversial, but just because people don't support one issue doesn't mean that an issue the next week isn't important to them. And so you just, like everyone else, you do your best to make relationships and understand people and their perspective. And that's part of that whole teamwork and partnership idea.
Yeah, that's great insights. And then the last question around being a commissioner of health, what kind of like takeaways or big insights did you get from being in this position for such a long time?
I think that you never know what's going to happen next, right? And we just saw this pandemic that we had, right? I mean, that's the extreme example. But on a day-to-day basis, things happen. And public health is broad. Things happen. You might have an environmental crisis one day. You might have an infectious disease outbreak the next day. And you superimpose those on the day-to-day challenges that people are facing in many areas of public health. I would say that it's really important to have goals for whatever organization and priorities that you can speak about to different people. So the Healthy People is the National Public Health Goals and Objectives for the nation. And we use a subset of those, but the idea was you can't do everything. So what does your data show you? What does your community tell you? What are your community partners telling you that are the issues that are most pressing and that are impacting the most people, that you can all agree that let's try and do something and make this better. So having a set of priorities, I think that's really important. And then I think that, and if you do that, you're always conscious of those. So even if you have an outbreak happen one week, well, as soon as you take care of that, you're right back on track with remembering you have to take care of what's right in front of you, but also keep your eye on your long-term goals. And that's how you make progress. And to me, you have to always, it's hard, always remain optimistic and don't get flustered when stuff happens, because that's what public health is all about.
I love that. That was a great answer. And I think that's important and can be used for someone that is a public health student, as all the way up to someone that's a commissioner of health in thinking and framing the issues and how they have to prioritize things and move things forward, depending on where the community sees the biggest need, where there's the most feasibility and the most amount of partners that are able to move those issues forward. So that was a great point. So I appreciate that. After being the Commissioner of Health, you moved on to become a clinical professor at the University of Vermont College of Nursing and Health Sciences. Tell us about how you come across this position and what did you do in it?
So I came back here, so I came back to the medical school. So I'm a professor of medicine here, and I'm Associate Dean for Public Health. And now I'm the Associate Dean for Public Health and Health Policy recently. And then I also have an appointment in our College of Nursing and Health Sciences as a clinical professor. So I'm thrilled with the breadth of that work, because as we just talked about, you have partners in many different disciplines and professions when you're in public health. So some of my colleagues are in nursing and health sciences. I work a lot with physicians. I work with people with PhDs, and we do research together, all kinds of different people. And one of the things that when I came back here full time to the university was we did not have an MPH, a Master of Public Health program, or graduate public health programs. And so we developed them. And I developed another partnership, a different partnership with our continuing and distance education group here on the university, and there was a dean of that office here, and we decided and we talked to faculty and students, and they wanted the flexibility of asynchronous online education. So we built our Master of Public Health program for the students, and did 100% online. And that we launched that in 2014. We worked also with the graduate college, and we have a variety of different faculty across the university. And then we became nationally accredited in 2021. And it is something that, I could talk about the value of public health education all day long. But that was something that now we had that program right here in Vermont, which we hadn't had before.
That's amazing to be able to start the program and then do all that work to get it accredited as well. And I know the point of like highlighting how important that online perspective was. So can you talk more about how to continue to increase access to public health education using online learning?
We have our students, when we looked at some of the people who are working in public health who may or may not have a master's or had the opportunity to have a master's degree or any graduate public health education. We have people who are working in health professions who were curious, like I was, about how can I improve the health of entire populations that I'm seeing. We have students who are undergraduate, and now more students are studying public health as undergraduates, and they decide that, well, I want to do this we have these accelerated programs where you can do 5 years and a 4+1 to get both degrees, and that opens a lot of career doors. I think what the students tell us is, particularly if we have students who are working professionals, and they can't take a gap in their lives, and so they can do the program part-time. When it's asynchronous online, it means that you don't have to be on with everybody in your class at the same time. You sort of think about if you were going to class, except that you're going to class online, and it's just like a week schedule, and you might have assignments and videos and discussions and quizzes and papers. Yes, all kinds of things and experiences in the community and projects and things like that. And so you're able to do that, have a little bit more flexibility. The other thing that the students tell us is that it really helps us. We are all committed to health equity, and diversity, equity, inclusion is really one of our foundational principles. And so students in our online environment have a much different educational experience than going to class with people who are in the same location, usually the same age as you, sitting in a classroom. Now they might get somebody who's been working in public health or is in a different, not in our community, in a different community, somebody who we have professors taking the curriculum. So you have a very a mix of different kind of colleagues that you learn from, in addition to what you're learning through the curriculum. And students tell us how much they really enjoy that and learn from each other.
I know during my MPH program, I definitely appreciated that because I didn't have much formal public health experience going into my MPH. So just being able to share space with people that are either working in working in public health currently, or just had different experiences, and bringing that to the topics that we're talking to in class and being able to have like deeper conversations with people around their work, I thought was very helpful. So yeah, that's awesome, and I'm glad that you're able to do that work. And then as an MPH program director, what are some of the things that you have to do?
Well, first of all, we make sure that we have a great faculty, and that our faculty, we have a mix of faculty here at the university and faculty who are part-time faculty who are out in the practice of public health. They might work at the Department of Health. We have one faculty member who's been very popular, worked for a large health insurance company, so could teach the health policy from that kind of vantage point. We have passionate faculty members in the area of global health and climate change who have had some lived experiences in different parts of the world. And so we try to bring a diverse faculty to teach our courses and interact with our students. I make sure that we have conversations with our faculty regularly, that we're always thinking about what do our students need, what supports do they need, for example. So if you're making a transition from an undergraduate to a graduate program, it depends on your background, what opportunities you've had to date. So their writing skills, math skills, different things you need for graduate education. I work hard to connect with our people at the university and talk with our faculty. And we talk about how our students are doing and what other supports they need. As an example, we had a lot of conversations regularly for our students during the whole pandemic time. And do we have enough supports in place? It's such a stressful time for everyone, including our students, and just the extra effort, the extra attention, it might be extra office hours to support our students on their academic journey to a career that they're passionate about. So those are some of my day-to-day activities, and we're always looking at do we have enough and variety? Not just when you go through an accreditation process as an accredited program, the things you have to offer the same that are required. And then in addition, are we thinking about the new skills that our student might need and developing elective courses or new directions for them? I was on a call earlier, actually an educational webinar early today about teaching public health students advocacy. That conversation we were having earlier, because it's so relevant now. And we just experienced this global pandemic. And during that time, the needs of preparedness, we know that the gaps in healthcare for everyone in our country, the impacts of institutional racism, all of those things were very evident, and the need for a stronger public health workforce. One of the most recent reports that I read from the de Beaumont Foundation, that was from like 2021, talked about a gap of about 80,000 public health professionals, about 2/3 in local and 1/3 in state health departments, like right now. So, who's responsible for that? Well, so that's on us, who are the individuals who are in charge of graduate public health programs, and making sure that we are helping students succeed and letting them know how much their career is needed and valued in our communities.
And how does this work differ from being the Associate Dean for Public Health and Health Policy?
It's all part of my job. I have different responsibilities in research and education, and part of my role, I teach medical students public health, and we do that by having them as part of a required part of the medical curriculum. The community submits public health project needs to us, and our students in groups of about 6 do those out in the community. There's things the community needs, and then they give that project back. So I do a lot in my role in the medical school here, and with our College of Medicine students and our public health students, and work with my other colleagues at the university. And I do a variety of public health related research that a lot of it involves promoting health equity in our rural communities, as well as engaging our communities in determining what the research needs and priorities should be.
And given this wide variety of experience and your role as the MPH Program Director as well as the Associate Dean, what should research goals look like for public health programs?
What should research goals look like?
Correct.
When we in graduate public health programs, MPH programs, having a research component is an essential part of that program. And it's important for students to have access to some of that research. So as a faculty right now, we're looking for opportunities to involve our MPH students more in our own research. They can do small internships. They have a busy curriculum. Lots of them are working at least part-time while they're doing it. And so how can we involve them in our research in small bits so they get a glimpse to see how important that research is to the practice of public health, that they actually have a research project to do as a part of the curriculum, and that is part of it's called the integrated learning experience as part of the MPH or the capstone project, where you do a large project with a group and you use a big database, and it's something that can discover a new aspect of that database for public health. For example, some of our groups have done projects around opioid addiction and access to treatment, things like that, and using some of the state health department data. They've used some of the behavioral risk factor surveillance system data as part of that national CDC data set that every state has, and we have one for youth, so that the students actually get to do a research project and learn how to work together in team science, write a manuscript like you would a published paper. They don't have to have it published to graduate, but they learn how to write that paper. They do a poster and have a poster session. So they learn the skills about conducting research in public health. And equally important, I think, is teaching them how to translate that science into practice, which is when we started our conversation today, we talked a little bit about how extensive that misinformation or lack of science literacy is. And so when our students are finished, it's not just academic knowledge. It's think about everything you learn and how do you apply it out into wherever you're working. If you're working for a not-for-profit organization, or you're working for a health department, or you're going on to get a PhD degree, or you're conducting research, how do you actually apply that knowledge, which is what we need to actually help people.
And last question before I move you on to the next part of the show is, what do you enjoy most about your role as MPH Program Director and Associate Dean?
Well, I really love people. So I love our students, and I love working with our faculty. So I think it's all about the team. I like the opportunity to collaborate with people in different professions, in different disciplines, whether that's in research or in our education. We're trying to do some of that with different colleges here at UVM. And yesterday we did a session for students who were considering an accelerated master's, and I talked with some of our own students, and that's the most fun of all.
Yeah, that sounds like fun, and just inspiring the next generation seems like a good place to be. So before I move you on to the Furious Five, the question that I will ask before that is, where do you see yourself in the future, and where can people connect with you?
Well, I never know what I'm going to be doing in the next year or two. At the current time, we are looking for new areas of in our program that might help our students go into different aspects of careers in public health. As an example, we just added a concentration in global health leadership because there was such a huge student interest and faculty interest in global health. And we looked at some of the reports about what was needed in that field. And it was to educate educational leaders who knew how to do the budget and supervise people and develop the programs that could be sustained when people left a certain area. So global health leadership. So that's the direction I'm currently going in. We're always looking at new research and additional ways to make health and lives better. One of the areas that I consider an enduring challenge here for Vermont has to do with the rural parts of our state. It's very challenging. Some of them are those barriers to access, or, can be everything from the roads to the weather, and not having enough health professionals in different areas and access. So those are a couple of the areas I'm working on right now. People can reach me I'm on LinkedIn, and they can email me, and my email is at the university. They can look at our website and they can contact us, but please, people should feel free.
Awesome. Well, look forward to seeing that work unfold at the University of Vermont, and I will definitely link those in the show notes for anyone that is interested in connecting with you. So moving you on to the Furious Five, the last section of the show, and the 5 questions I ask all guests. So number 1, what advice would you give to a student trying to pursue a career in public health?
I would say, I think it's what was on the Nike sneakers. Just do it. Just do it. And if you are able to get that master's degree, I think that opens the door and provides you with the skills and some experiences out in the community to really launch your career. Most important thing, I think, is that follow your passion. And when students apply to our program, we ask them to write a personal statement. And that's the most important thing of everything I read, because it tells me what's motivating them, or what it is that they're seeing, either have seen in their life or are seeing in their day-to-day work, that it's bothering them, or they think they should contribute to making it better. And if you are seeing that in your own life, public health may be a direction you should really consider.
Number 2, if you're talking to someone wanting to get into your position, what advice would you give them?
Keep working. And I think that whole, I mentioned the importance of lifelong education. And I think I learn new things every single day. And that is my advice to students and peers and faculty, everyone I work with, is we have to keep learning. And part of that is, what's the new science, and where's the gaps in science? So if we do research, can we contribute to something that people don't know about or understand, or how to translate? So keep learning.
Number 3, what's something you're working on improving in your life right now?
I would say I can't. If I could put just a couple more hours in every day, that would help me so much. But I can't. So I think that those priorities, and always keeping those priorities in front, and I tell everyone I work with, and we all have to have, whatever you call it, it's your balance in your life. It's what keeps you centered. And it may be family, it may be friends, it may be a faith community, it may be outside interests that give you a perspective and give you energy to keep doing what you know is important to do.
Number 4, professionally, do you recommend anything?
So something maybe a book to read, or something that might be. I took the time over the summer, and I reread Viktor Frankl's Man's Search for Meaning and Elie Wiesel's Night. And both of those were very serious books, but they get at the core of, I think, of why we do what we do. It's there in the midst of, and we see it all around us. We see it in neighborhoods, we see it in healthcare, depending, you can't not see, or unfortunately in the news every day, you see human suffering and tragedy. And I think that the lessons from those books, written at that horrible time in the Holocaust years, around what could be done to alleviate human suffering, and that at our core, I think we all want to contribute to that.
Absolutely. And I'll be sure to link those books for people that are interested in checking those out. And then number 5, last but not least, if there was one piece of advice you'd give your younger self, what would it be?
Well, if I knew what public health was in elementary school, I would have saved myself a little bit of time. But other than that, I think, I don't know. I don't think I would change too much. I feel like I've been very fortunate myself and had opportunities to work with so many people who shared the same vision, and nothing is more rewarding than that.
Well, that is phenomenal. Thank you so much, Jan, for coming on. As I said at the beginning, I was thoroughly looking forward to this conversation and it didn't disappoint. So I appreciate all the experiences and insights that you share with us today.
Thank you very much.
Truly, truly is my pleasure. So housekeeping items, everyone. Thank you all so much for watching. Be sure to like, subscribe, and leave a review if you have not as yet. It really helps the show get out to more people. So be sure that you are liking, subscribing, and leaving a review. Thank you all. Peace.